In this video, we are going to talk about how to become a good ganotherapist. Many people, when they learn ganotherapy, they committed two very serious mistakes. First, they try to treat disease. They keep on asking, how to treat diabetes, how to treat hypertension, how to treat cancers, especially cancers. Many people keep on asking me, how to treat cancers. Now, your body is a very complex organism. And if there's anything wrong inside your body, there will be signal that coming out from the body. This is what we call ailment reflections. Your body tries to talk to you, okay? But the problem is that it cannot talk in human language. No English, no Chinese, okay? But the body talks to you through symptoms, through diseases. So you as a ganotherapist, first thing first, you must understand the language of the body. Okay? So instead of treating the problem, you are treating the signal. When you buy a car, okay, there is a lot of panel in front of the car. Okay? Something wrong with the brake oil. So the warning for the brake oil coming out from the car. What you do? Okay, you go to the mechanic. Okay, can you tell the mechanic, the light is disturbing my eyes now. Just remove the light for me. Will you solve the problem? You will not know. So even if you remove the light, then you see you go for your car, driving the car is very risky, When you brake, your brake may fail. The same thing with our body. Our body have some problem, and the signal come out as diabetes. And you try to treat the diabetes, you will never treat diabetes. And many times the treatment fail. Then, just like your brake fail, then you have a lot of health problem. So, you cannot treat the diseases, believe me. I also have many doctor friends, Okay, they agree with me. You can just manage the disease, you cannot treat the disease now. If you try to learn the disease, try to treat the disease, you can do that. There are thousands of diseases now. It takes you 5 to 6 years to learn just to name the symptom of disease now. And there's no guarantee that you can do anything with them. Okay, so remember, disease is just a signal from the body. It is not the true problem. Okay, this is the thing. So never try to treat disease. That is the first thing first you need to learn to become a ganotherapist. So you take the disease as a language of the body, okay, to understand the body, not treating the disease. That's the first mistake many people were committed when they try to become a ganotherapist. The second mistake is that they try to know the ingredient of ganoderma, spirulina. Keep asking me, what is inside ganoderma? How many things? Ganoderma contains 400 types of ingredients. Are you going to study all the ingredients to become a ganotherapist? No, you will not. You will study all the ingredients, all the 400 ingredients, so you committed to memory, you still do not become a ganotherapist. Just like I'm telling you, you study the herbs, one herbs after the other, keep on study thousands of herbs, hundreds of herbs. You become a botanist. You do not become a ganotherapist. When you study ganoderma, all the ingredients inside the ganoderma, what type of ganoderma, you become a ganoderma specialist. You know a lot about ganoderma, but you know nothing about ganotherapy. So, don't keep on asking me, what is a constituents, what are the ingredients inside the ganotherapy. If you are interested in the ingredients inside the go to internet. Last time, in the early day, there's one member, he printed one thick printing for the ganoderma. He presented a book for me, about 2 to 3 inches, We get all the information from the internet. I told him, you will not become ganotherapist by reading through all these things, No, you will not. It's not the way, to become a ganotherapist. Okay? Now, then how to become a ganotherapist? So, you need to do a few things. Okay? In our past video, we thought that you need to go for training. The training of diagnostic. You need to diagnose now. What is the problem? Maybe you need to understand what is the language of the body. Secondly, you need to formulate the treatment. What type of treatment will be suitable for this type of problem? Body problem, no. Not disease, no. Not the treatment for disease, remember that. How to balance back the body. How to detox, no. Only these two things. We don't talk about treating of disease. The third thing is that, what are the products? What are the herbs you need to combine to solve this problem? Lastly, what is the components? So what are the products that you should know, and what are the dosage? So these are the 4 things that you need to go through. Now today, I just give you the introduction of diagnostic. Okay. Similarly, you want to diagnose a person, you also need to go through 4 steps. First step is observation. You must look at the patient and look at someone come to you. What is the age? Is it a child? Or is it a young man, a young woman? Or is it a matured man? Or is it an old man? Okay, first look at him, the age. Second, the gender. Is it a man or is it a woman? Thirdly, is his metabolism overactive or deficient? Is he aggressive, talking loudly, what do you call, very impatient, very restless, that is excessive in metabolism? Or sometimes he is very withdrawn, reserved, doesn't want to talk much. You ask him also, he's quite reluctant to answer to you. This is low in metabolism. Okay. Then you started to form the picture, no? Okay, this one we call it the symptoms picture. The symptom, no? These are these things. Secondly, you must listen, to him. Then he will talk to you. What is his problem? What is his complaint? Listen carefully, This will give you a lot of information about the patients. Okay, listen. Okay, don't keep on talking. No. Let him talk to you and listen to him. After listening to you, okay, the third thing is that you must start to ask some basic questions from head to toe. Okay, for the head, how is your sleep? Do you have any headache? Okay, is the hair dropping or not dropping? Okay, how is the hearing, eye, all these things? You ask this thing. The neck, are you feeling thirsty? Is there any stiff neck? All these are the questions. You can ask him. Okay, you ask him. Okay, how long your disease? What are the complaints? Okay. Lastly, you should check the pulse, check the tongue. From the pulse, you can know that his metabolism is excessive or deficient. So when the pulse pumping, very hard, okay, then it is excessive. The body is heaty or lack of heat, When it's heaty, the pulse is fast. When the body is cold or lack of heat, okay, is loose, slow and loose. Now I'm going to teach you separately, okay, how to ask a question, how to observe this thing. That will be in the next video. I'm going to teach you. This video I just give the introduction. Okay, then you look at the tongue. Then for the tongue, go to the tongue, then you can know whether you have any water congestion or no water, or the body is dehydrated, or any blood status. Okay, look at the body of the tongue. Sometimes there is some blockage of blood, then the tongue become purple in color. Okay, you can see the color of the tongue. That one we are going to teach you in the coming video. Okay, then after that, after the diagnosis, you form a full pictures of the patient. This one we call it the symptoms picture. In summary, you need to go through the 4 process. First, you observe the patients. Okay, observe him. Okay. Secondly, you listen to him. Thirdly, you ask question, Ask question, what is the problem? And ask question. Fourthly, you check the pulse, look at the tongue. Then you form a full picture. Then you know how to formulate the treatment to balance the body. Okay. Now, all these things we are going to discuss in future. So today, I just give you a brief introduction. Okay. See you then. Bye-bye.